Thank you. I've already had some great content on policy. I'm going to talk a little about process. How do we go about this and how do we treat each other? What I heard today was people grappling with the fact that this is a dilemma and not a problem. Problems have clear solutions. A problem is a cholera outbreak. You clean the water, the cholera goes away, everyone is happy. No one says, please, can I have some cholera? I'm having some people over. I'd just like to have a little cholera. But opioids are not like that. I worked 9 years in hospice care. Hospice care without opioids would be a horror. No one has to convince me how incredible these medications are and how lucky we are to have them. I'm also a native West Virginian, and my state is being destroyed. And I'm appalled at how it's being destroyed. And I was in Iraq. I've seen horrible things, and I'm just stunned by the horror of addiction. Both those things are true. That makes this a dilemma. It's not something that's a problem that we can just have a clear solution that does not in some way cut against someone else's interest. The nicest expression I've heard of this sentiment comes from Sean Mackey, who's a terrific pain medicine doc who runs pain medicine at Stanford, and he says, we should not be pro-opioid or anti-opioid. We should be pro-patient. So we want to have that sentiment that this is a dilemma and it's going to be different solutions for different people. The second point is then there has to be some respect and compassion for whoever is suffering from some policy or procedure. And there's not enough of that, and not just on Twitter, in everyday life. People, furious. How dare you say that someone could become addicted to their pain medication? Addicts are dirty people. What an awful thing to say. Well, I don't think they are dirty people. I think they're our neighbors, our friends, our family, and they're human beings, and they're worthy of respect. How dare you, people call pain patients whining, complaining. They need to buck up. Again, that's just degrading, nasty, and it creates an environment where it is impossible to think clearly because everybody is understandably hurt and angry. And when we are hurt and angry, and this has been demonstrated actually by experimental social psychologists, we don't think very well. We tend to think in black and white and extreme solutions, and we fight much harder for what we think is right, and we don't listen. So we need to have that, grasp the dilemma, have respect for each other, have compassion. And the last thing is we need to have nuance. Nuance is often in short supply in policy, but if you look at it globally, people say too many opioids, not enough opioids, you can get into a big argument. But when you get down to the specifics, you can often find places where you can agree. Like, do we like it that 40% of people who go to an ER in Arkansas with a sprained ankle walk away with 30 Vicodin? No, that's a place where we can cut back without hurting any chronic pain patient. And if that's your kid getting that Vicodin, as a parent, you're absolutely delighted at that reduction. There are places like that where we can help. Same thing on the addiction side. There's some wonderful modeling work done by Allison Pitt, who's a terrific graduate student. It's her dissertation. She published it in American Journal of Public Health, PITT. I suggest you look at it. But she shows there are some unambiguous wins in this space. Giving access to naloxone hurts nobody, helps everybody. We can rally around that. Expanding quality treatments for addiction hurts nobody, helps everybody. We can rally around that. But to see those points where we can rally, again, we have to be willing to listen, show compassion for each other, and exercise our ability to look at a complex dilemma with nuance. I'll just leave it there.